And joining us now is Angela's plastic surgeon, my friend Dr. Nicholas Sieveking, and his colleague Dr. Jeff Claiborne. Before we see Angela and her transformation, this is just a reminder of all that extra skin she was dealing with before, but she is here today. Angela, come on out and join us.
I'm great.
Awesome. Thank you. Oh my goodness.
Thank you. Thank you.
So let's just take a moment to admire your transformation.
I know, it's amazing.
And all you really have to do is just look at the smile on your face.
I know, like I was watching backstage and like even I was getting emotional just looking at it. Like it's crazy how different it is, and like my brain still hasn't quite caught up yet.
Oh, and you know, obviously that scar is going to lessen over time. I just
don't even care about the scar. It doesn't bother me.
No, I know, but I just can't believe, because it's not that far out, so you're clearly pretty happy.
Very, very much so. It's so different. Like I tried on a bikini for the first time. My little girl picked it out for me. Yeah.
Well, you deserve it.
Yeah.
Dr. Sieveking, big surgery. I mean, you alluded to it a little bit. Teamwork, the two of you teaming up. There's so many advantages to that. I mean, you hit all of those areas that get hit the hardest with massive weight loss.
Correct, yeah. Well, first off, before we made our plan, we had to make sure Angela was healthy.
Right,
you know,
good point.
And as you know, patients who undergo weight loss surgery do suffer from nutritional deficiencies. So we took Angela through a battery of tests, a nutritional test, food sensitivity test, and she scored about as perfect as I've seen.
There you go.
You know, and that's a real testament to how she takes care of herself and her knowledge on nutrition.
Good job.
Yeah, I mean,
that's an important part of all this.
This is an elective surgery. You have to make sure that your patient is the ideal candidate.
So how'd you tackle all the extra skin?
Okay, well, it was a big surgery, and having my partner with me, Dr. Claiborne, we came up with a good blueprint that would allow us to do as much work as possible for Angela, but in a safe period of time. My role was really to do the tummy tuck and muscle repair and the abdominal wall and remove skin from the back and the arms. Dr. Claiborne performed safe liposuction, took off skin from her upper back, and then he did the breast lift with the implants.
Dr. Claiborne, how is that different, that safe lipo?
So traditional liposuction just has one step, and that's suction. The problem is that fat has a jello-like consistency, and trying to suck jello through a straw isn't ideal, and it can leave dents. So SAFELipo was developed to overcome these challenges. And so what it does is, it's not a device or technology, it's a technique, and it adds two steps. It has a separation step to liquefy the fat, so you have more precision for fat removal. And then it also has a smoothing out step at the end to help make sure there's no lumps or bumps left behind. And I've just found that spending the extra time doing those two steps has just delivered better results for my patients.
As Dr. Orton knows, rarely do you go through these massive skin removal surgeries without complications. You know, the skin's lost elasticity, it's thin, you know, oftentimes incisions open up. We didn't experience any of that with Angela.
None at all.
Well, we knew you had a good candidate going in, and you know, it's always amazing when two plastic surgeons can work next to each other and stay out of each other's way, right?
Well, I joked he had the old guy with tried and true methods, but the young guy with the new technology. So.
There you go.
All right.
That's a good combo.
And it seems like this has had a profound impact on your confidence.
Oh, absolutely. I told them they've turned me into the most cocky person ever.
That's okay. Summer is not ready for you, right?
I can't stay out of the mirror. Yeah, it's...
You deserve it. And you work hard with diet and exercise, so it's not just the surgery. You are doing your part.
I try really hard.
Yeah.
Well, you deserve this. Keep up the great work. Dr. Sieveking, Dr. Claiborne, thanks so much for your help. And enjoy those bikinis, Angela.